Vitiligo affects the skin in one particular way. It specifically means that you lose the ability to form color within your skin. So it is what we call complete depigmentation, the loss of all color within your skin. It can happen on any part of your body at any age, at any time, I'm afraid. We do not actually know the exact cause of vitiligo. What we do know is that your own immune system decides that the color forming cells in your skin are foreign and decides to attack the color forming cells. Now, that's very interesting. Why would the body do that? Because one fact we do know, which was recently found out, is that the actual incidence of skin cancer in vitiligo patients is 300% less than patients who don't have vitiligo. So vitiligo actually protects you against skin cancer. So I wonder, and this is mere speculation, my personal theory is, I wonder if vitiligo is your body's way of defending yourself against skin cancer, but it gets switched on when it shouldn't. I must emphasize this is my own theory, but we don't actually know why the immune system should start attacking the color forming cells. But I think it's really heartening to know that it decreases the incidence of skin cancer. So I wonder if this is a way of bodies defending ourselves against skin cancer. But like I said, that's only my theory. The appearance of vitiligo can be very slow and insidious, where you get a slight loss of color in your skin, and then gradually you lose all of the pigment. However, there can be instances when a patient just wakes up and they suddenly find an area of color loss, which gradually increases in size. So it can actually appear suddenly or appear gradually. So the thing to really watch out is loss of color or decreased color, which could be a sign of vitiligo. Now, vitiligo is diagnosed because there's a lot of other conditions which results in loss of color. So what we have to differentiate is what makes vitiligo so different from these other conditions that also cause decreased color within the skin. Now, there is a special lamp that dermatologists use called a Wood's lamp. And it's an ultraviolet light which is shone on the skin. And there's a distinctive appearance of the vitiligo. You get what's called the accentuation of the vitiligo. It becomes bright white like a sheet, which is very, very distinct for vitiligo. So those of us that see a lot of vitiligo use the Wood's lamp consistently and all the time, because that allows you, this special lamp, to actually make your diagnosis of vitiligo. In fact, I find it virtually impossible to make a diagnosis of vitiligo without this special lamp. Now, at the moment, there are no licensed medications for use in vitiligo. There have been recent studies on a medication called tafasitamab, when it is combined with ultraviolet light, has been shown some consistent results, but it's not licensed yet. So I'd like to emphasize that all of the treatments we use in vitiligo are not actually licensed, but they do work. Now, there are these things called topical steroids, which decrease the immune system's ability to kill the color-forming cells. But the problem with these topical steroids is they tend to thin the skin. And also, as a side effect, they tend to lighten the skin as well. So we tend not to use topical steroids that much in vitiligo anymore. Now, there is another treatment called tacrolimus, which is licensed for use in a condition called eczema. Now, what this tacrolimus does is stop the immune system from attacking the color-forming cells. But what this tacrolimus also does is, when you apply it on the vitiligo and the surrounding normal skin, it causes the color-forming cells to migrate into the vitiligo as well. So the tacrolimus has two effects. One, it stops the immune system from attacking the color-forming cells, but two, it also gets color-forming cells from normal skin to go into the vitiligo, to repopulate the vitiligo, and thereby producing color in the areas of vitiligo. So tacrolimus used on its own twice a day can be very effective in vitiligo. Now, the other thing that can be very effective in vitiligo is a treatment called narrowband UVB, which is a select ultraviolet treatment machine that we have, a lot of dermatology clinics have within their clinics, or you can buy them at home. And you can do, if you bought a narrowband UVB machine at home, then doing the UVB 2 or 3 times a week can have quite significant impact on the vitiligo. Now, more controversial, and there's a lot of clinics that are doing that, is that where you combine the tacrolimus and the narrowband UVB together as a treatment, which means quite a dedicated treatment, and it is not licensed. And some people would argue that what you are doing is combining ultraviolet treatment with tacrolimus that we know depresses the immune system. There was some worry as to whether this might predispose or increase the risk of the patient having skin cancer. However, as I said earlier on, that we now know that vitiligo patients actually get a lot less skin cancer. And therefore, I personally do not worry about any increased risk of skin cancer that may be from the combination of tacrolimus with narrowband UVB, because vitiligo patients are so well protected against skin cancer. But this is a debate which us dermatologists are continuing to have all the time.